Hello Year 11, I hope you're well. Welcome to your next lesson, PSHE lesson, focusing on health and well-being. Last time we looked at healthy eating and eating disorders. This time we're looking more on the outside, all right? We're looking at keeping your skin safe. So first thing I'd like you to do is to pause the video here and have a look at that question I've got at the bottom of the screen there. Can you think of any risks that might be involved with the images above, right? 3 pictures there. Just have a look at what you think each of them might be and consider what risks you can think of to do with each. Pause the video, play again when you're ready. Okay, I'm not going to go through the answers just yet, but I just wanted you to get your thoughts down, just to see what you thought about each of these things, because I'm going to go through these in a lot more detail moving through this lesson. So, keeping your skin safe is our focus for today, and today's aims are to understand how to keep our skin safe when considering the acts of tattooing, piercing and sunbeds. Alright, but please note, a big thing I'm going to put up here is the aim of this lesson is not to say you must not do these things, okay? My job here isn't to sit here and go, you shouldn't get tattoos, you shouldn't get piercings, things like that. The aim is to give you an awareness of the risks of each so that you can make a safe and informed decisions about the things that will affect your skin, okay? So I'm not saying don't get tattoos, don't get piercings. I'm saying if you're going to do it safely, okay? And this is the information that's going to come about as we move further and further through the presentation. So, beginning with tattoos, what is a tattoo? A tattoo is a permanent kind of body art. It's a design that's made by puncturing the skin with needles and injecting ink, dyes and pigments into the deeper layer of the skin. Tattoos used to be done manually, that is, the tattoo artist would puncture the skin with a needle and inject the ink by hand, and though this process is still used in some parts of the world, professional tattoo artists now tend to use tattoo machines. A tattoo machine powers the needles up and down as ink is deposited in the skin. And the process, which is done without anaesthetics, causes a small amount of bleeding and slight to potentially significant pain. It's going to depend on where on the body you have the tattoo, how large the tattoo is, how detailed it is, and various factors like that, okay? Tattoos, understanding the risks and precautions. Tattoos might be more common than ever, but don't take the risks lightly. You need to understand basic safety precautions and aftercare. You could be the proud owner of a new tattoo in a matter of hours, but don't let the ease of the process stop you from thinking carefully about permanent body art. Before you get a tattoo, make sure you know what's involved and how to reduce the possible risks, okay? So know the risks. Tattoos breach the skin, which means that skin infections and other complications are possible, including allergic reactions. Tattoo dyes, especially red, green, yellow and blue dyes, can cause allergic skin reactions such as an itchy rash at the tattoo site. This can occur even years after you get the tattoo, okay? Certain skin infections, which are also possible after tattooing. Other skin problems, sometimes an area of inflammation called a granuloma can form around tattoo ink. Tattooing can also lead to keloids, raised areas caused by an overgrowth of scar tissue. Bloodborne diseases. If the equipment used to create your tattoo is contaminated with infected blood, you can contract various bloodborne diseases, including methicillin-resistant staphylococcus, MRSA, hepatitis B and hepatitis C. MRI complications. Rarely, tattoos or permanent makeup might cause swelling or burning in the affected areas during magnetic resistance imaging or MRI exams. In some cases, tattoo pigments can interfere with the quality of the image as well. Tattoos, making sure you're ready. Before you do get a tattoo, think carefully about it, okay? If you're unsure or worried that you might regret it, give it more time and don't allow yourself to be pressured into getting a tattoo. And don't get a tattoo if you're under the influence of alcohol or drugs, okay? Generally, wise decisions could not be made if you're ever under the influence of alcohol or drugs, so it's best to not make a decision about things such as, permanently marking your body if that happens to be the situation you're in. Secondly, choose the location of the tattoo carefully. Consider whether you want the option to hide your tattoo under clothing, and also remember that weight gain, including pregnancy weight gain, might distort the tattoo or affect its appearance. So just being aware of where you're putting it, okay? Tattoos, insisting on safety precautions. To make sure your tattoo will be applied safely, ask these questions. Who does the tattooing? You need to go to a reputable tattooing studio that employs only properly trained employees. Keep in mind that regulation requirements and licensing standards vary, all right, depending on areas and different countries. So check with your city, county and health department for information on local licensing and regulations. The next one there, does the tattoo artist wear gloves? Make sure that the tattoo artist washes his or her hands and wears a fresh pair of protective gloves for each procedure. Does the tattoo artist use proper equipment? Make sure the tattoo artist removes the needle and tubes from sealed packages before your procedure begins. Any pigment trays or containers should be unused as well. And the last one there, does the tattoo artist sterilise non-disposable equipment? Make sure the tattoo artist uses a heat sterilisation machine, known as an autoclave, to sterilise all non-disposable equipment between customers. Instruments and supplies that can't be sterilised with an autoclave, including drawer handles, tables and sinks, should be disinfected with a commercial disinfectant or bleach solution after each use. You are allowed to insist on these things. You are the customer. You are the one paying for this service. You have a right to ask these questions, okay? So always feel free to do so. Any reputable tattoo artist will be more than than willing to confirm that they comply with these rules. Okay, better to be safe than sorry in these situations. Tattoos, taking good care of tattoos. How you care for your new tattoo depends on the type and extent of work done. Typically, however, you'll need to keep the tattooed skin clean using plain soap and water, and cleaning it gently. While showering, you need to avoid direct streams of water on newly tattooed skin, and then just be careful drying it. Using moisturiser is always advised, using a mild moisturiser to try and help heal the skin, but using it several times a day. Avoiding sun exposure, right? You've just done this to your skin. Your skin's going to be quite vulnerable. You need to keep the tattooed area out of the sun for at least a few weeks. Avoid swimming, because of the chemicals. Choose clothing carefully. Don't wear anything that might stick to the tattoo. That could get painful. And allow up to 2 weeks for healing. So don't pick at any scabs, which increases the risk of infection and can damage the design and cause scarring. This also might mean, depending on what job you do or other things you do in your life, you might need to bear that in mind. The fact that for a couple of weeks you can't, you need to allow those 2 weeks for healing. If you think your tattoo might be infected or you're concerned that your tattoo isn't healing properly, contact your doctor, okay? Everything I tend to say in these videos always tends to go back to speak to your GP, okay? If your tattoo isn't what you expected and you're interested in tattoo removal, there are facilities for that as well, okay? Moving on then to piercings. So a body piercing is just what it sounds like, a piercing or puncture made in the body by a needle. After that, a piece of jewellery is inserted in the hole. Commonly pierced body parts are the ears, nose and the belly button, and other common piercings include the lip, tongue and cheek. Okay, just some examples on the screen there in the pictures. Piercings, know the risks. Any type of piercing poses a risk of complications, including allergic reactions. Some piercing jewellery, particularly pieces made of nickel, can cause allergic reactions. Oral complications, okay, so that refers to any piercings to do with the mouth, that phrase there, okay? Jewellery worn in tongue piercings can chip and crack your teeth and damage your gums. Tongue swelling after a new piercing can interfere with chewing and swallowing and sometimes breathing. Skin infections, this might cause redness, pain, swelling or a pus-like discharge after a piercing. Other skin problems, piercing can lead to scars and raised areas caused by an overgrowth of scar tissue called keloids. Bloodborne diseases, if the equipment used to do the piercing is contaminated with infected blood, if it hasn't been cleaned properly, you can contract various bloodborne diseases, including hepatitis B, hepatitis C, tetanus and HIV. And the last one there, tearing or trauma. Jewellery can get caught and torn out accidentally, potentially requiring stitches or other repairs. So again, it's being aware of how to care for these things safely. And similarly to tattoos, make sure you're ready when it comes to piercings. Before you get a piercing, think carefully about it. Consider the location and whether you'll be able to conceal the piercing if necessary. Such as at work, there are many job fields where there are certain restrictions on the type of jewellery you're allowed to wear, if any. Or I know that often if you work in food, you're not allowed to have any jewellery on in case it falls out. All right, and other places you might not be able to have dangly earrings or anything that people could grab hold of or anything that might get caught in anything as part of health and safety. So just be aware of that. If you're unsure about the piercing or worry that you might regret it someday, consider waiting. Don't let yourself be pressured into getting a piercing, and don't get a piercing if you're under the influence of alcohol or drugs. Similarly to what I said with the tattoos, okay, generally we're not in a position to make very good decisions if you're under the influence of something, okay, so make sure you have a clear mind when you go into these things. If you're sure you want to get a piercing, talk to friends who have them, okay? Find out if they have suggestions or regrets. They might be able to recommend a good place to go, or they might say avoid this place. They might be able to talk about piercings in particular areas, okay, and how long the aftercare took, and all these various types of things. So it's always worth just asking around. And the last one there, if you're thinking about getting pierced, do your research first. If you're under 18, some places won't allow you to get a piercing without a parent's permission. And some require that a parent be present during the piercing, okay? I think there are rules around it, but again, it's just a case of doing your research and making sure you're doing things properly. Once again, insisting on safety precautions. Like I said with tattoos, you are the paying customer. You are allowed to ask these questions and demand that they prove that they're doing things properly. So to make sure your piercing is done safely, ask these questions. Who does the piercings? Don't attempt to pierce yourself or allow an untrained friend to do the piercing. Things may not go well. Go to a reputable piercing studio where employees are properly trained, okay? Does the piercer wear gloves? Make sure the piercer washes his or her hands and wears a fresh pair of disposable gloves for each piercing. Does the piercer use proper equipment? While some venues use piercing guns for earlobe piercings, the Association of Professional Piercers cautions that reusable piercing guns can't be properly sterilised and can damage ear tissue. For earlobe and other bodily piercings, look for a piercer who uses a fresh, sterile, disposable needle to create a hole and then inserts a piece of jewellery into it. Okay, that's the advice there. Does the piercer sterilise non-disposable equipment? Make sure the piercer uses a heat sterilisation machine to sterilise all non-disposable equipment after each piercing. And the last thing to consider, does the piercer use hypoallergenic jewellery? Okay, what is it that's going into this piercing, that hole that's been created? Look for surgical stainless steel, titanium, niobium, or 14 or 18 karat gold. Okay, make sure it's something that's not going to have a reaction, okay? And the last thing there, take good care of your piercings. The skin around a new piercing might be swollen, red and tender for a few days. It might bleed slightly, all right? If the swelling, redness and bleeding lasts longer than a few days, contact your doctor, okay? Prompt treatment can help prevent potentially serious complications. And to prevent infection and encourage healing, all right? Clean oral piercings with mouthwash. So again, piercings that are anything to do with the face and mouth, all right? So tongue, cheek, lip. Okay, you need to make sure you're keeping them clean. Clean skin piercings, all right? Avoid swimming, again, chemicals. Don't fiddle with the piercings, okay? Don't, play with them too much because that could really irritate the skin. And keep the jewellery in place, okay? Most piercings heal within about 6 weeks, but depending on where it is, it might take longer. On the whole, wherever you've had these things done, tattoos or piercings, they should tell you how to care for it once you've had it done, okay? They should be able to provide you with the materials and the correct information. Moving on to the last section of today's lesson then, sun safety. We're going to look at staying safe in the sun and the risks and precautions of sunbeds. So sunburn. Sunburn is red, hot and sore skin caused by too much sun. It may flake and peel after a few days. You can treat it yourself usually, and it usually gets better within 7 days. So if you are suffering from sunburn, do get out of the sun as soon as possible. Cool your skin with a cool shower, bath or damp towel. Apply after sun cream or spray. Drink plenty of water to cool down. Take painkillers such as paracetamol or ibuprofen for any pain. And cover sunburnt skin from direct sunlight until skin has fully healed. And don't do these things down here, okay? Stick to the things that you are supposed to do when you're looking after sunburn, okay? Sun safety. Sunburn increases your risk of skin cancer. Sunburn does not just happen on holiday. You can burn in the UK even when it's cloudy. And there's no safe or healthy way to get a tan, okay? A tan does not protect your skin from the sun's harmful effect, okay? But what you need to do is aim to strike a balance between protecting yourself from the sun and getting enough vitamin D from sunlight, okay? So it's all about controlling how much exposure your skin has to the sun. Sun safety tips. You should spend time in the shade when the sun is strongest. In the UK, this is between 11 AM and 3 PM from March to October. You should make sure you spend time in the shade between those times. Make sure you never burn. Use sunscreen. Cover up with suitable clothing and sunglasses. Take extra care with children and use at least factor 30 sunscreen. They do sell factors that are less than that, all right, but we should be aiming for that as a minimum. And using sunscreen. Sunscreen, also known as sunblock or suntan lotion, is a lotion, spray, gel, foam, stick or other topical product that absorbs or reflects some of the sun's UV light and thus helps protect against sunburn. Diligent use of sunscreen can also help to slow or temporarily prevent the development of wrinkles, dark spots and sagging skin. Do not rely on sunscreen alone to protect yourself from the sun. You should wear suitable clothing and spend time in the shade when the sun is at its hottest. And when you are buying sunscreen, you should look for the following things on the label. It should have a sun protection factor, which is an SPF of at least 30, I believe it goes all the way up to 50, against UVB and at least a 4-star UVA protection. Okay, UVA protection can also be indicated by the letters UVA in a circle, which indicates it meets the EU standard. Make sure the sunscreen is not past its expiry date. Okay, most sunscreens have a shelf life of 2 to 3 years. Okay, even if you've got loads left, if it's been more than a couple of years, if it's gone past its shelf life, it will not do anything for you. Do not spend any longer in the sun than you would without sunscreen. And I've just put this picture at the bottom here, and this is something that you should have on any reputable brand of sunscreen. Okay, so first of all, the fact that it says UVA in a circle shows that it does contain UVA protection. However, the stars then also indicate how good the protection is. Okay, so obviously the more stars you get, the higher rating it has, okay, and the more protection it's going to give you, absolutely. All right, so do make an awareness that it's normally on the back of the bottle, all right, and always look for that. The next thing for us to consider, sunbeds, are they safe? And I'm going to pause this video here and I'm going to carry on with this bit in the next one because of recording time limits. Okay, so finish with this video and move on to the next one for the next part of this lesson.